I want to introduce myself and my panellists here. So my name is Emma Storn. I'm the editor of Enable magazine, the UK's leading disability lifestyle title. We cover everything from celebrity interviews to employment, housing, finance. So once we're done, please feel free to come pick up a free copy just over there at stand H6. So today, as I said, we're covering the financial implications of living with a disability, and we have three brilliant panellists to help us do that. So we have Dan White, we have Karen Pierce, and we have Michael Grummet. So I'm going to give them all a chance to introduce themselves first, a bit about why they're here on this topic. So Michael, if we maybe start with yourself.
Hi, I'm off the vet and I am a sick person. I've employed my PA for many years, and I'm just here to pass on my own personal experiences.
Perfect, thank you Michael. Dan?
Good afternoon everyone, I'm Dan, I'm Policy and Campaigns Officer at Disability Rights UK. I'm autistic, I have bipolar, and I'm a carer to my disabled daughter Emily, who has just finished her first year at college, and I can't believe how quickly time has gone. But yes, a lot of my policy work really does revolve around cost of living crisis.
Hi everyone, I'm Karen Pierce. I'm the Director of Policy and Engagement at the Wheelchair Alliance, which is a community interest company with the aim of making sure that people get the right wheelchair at the right time. We focus on research, evidence and data to help us lobby for change.
Everyone. So we'll start off with our first question, which I'd love to direct to all of our panellists, and that really is, what are some of the kind of specific implications financially of living with a disability, and how can they affect different groups? Now, I'm going to pass around the wireless microphone safe, swinging the cable to everyone. So Karen, do you want to maybe start with that one? We're going to ask everyone.
It's huge financial implications of having a disability. Obviously, from the Wheelchair Alliance, we're focused on getting. Thank you. We're focused on people being enabled to have the right wheelchair at the right time. But there's so little investment into wheelchair provision. It hasn't kept up with the needs of society, and certainly it hasn't changed in the last 10 years for national health provision. So we're looking at really supporting that, because not everybody is able to self-fund or top up for a wheelchair. With the current cost of living challenges, this is only going to get worse. So certainly from a wheelchair point of view, the financial implications of being independent and enjoying the lifestyle that you choose to live are quite significant.
Very good point, I always say, but in order to give my answer to that, what are the financial implications? Well, obviously, you start with health, which leads on to mental health. It's just all-encompassing, really. I mean, the community at present is being hit from all sides within this cost of living crisis. Through the work I do, it's last year was heating, and it still is heating. I mean, the energy prices haven't come down. It's food, it's medication, it's transport. One thing I'm finding this work is bleeding into everything else. But disabled people really are now starting to slip below the waterline. Finances are so tight, people are so desperate, benefits are so low, opportunities are so low for disabled people to progress further into society. And that's the biggest worrying aspect for me, is that our voices are becoming quieter and quieter because they're not. No one's directing themselves to us in order to enable to give us our voices. I mean, this is why places like Expo are so good today, for people to be able to articulate themselves and the crisis they're in. But the financial implications are bad, and they're getting worse, and they'll get a lot worse unless there's governmental action. That's really what comes down to. Sorry for stuttering, but it's just
flickering. I'm holding it in.
It just really irks me. It has to start at the top. The government have to get involved and enact policies and start looking at disabled people in a different way. Start to abandon the stereotypes around what a disability is. They have to stop the narrative that to be a human being in the 21st century, your value is based on your production. That isn't the case. Your value is based on who you are. It really is. We have to stop tick boxing people to say, okay, you can have money because we can sit you on a little desk or put you on a little production line. We have to get rid of all that narrative as well and start to value human beings and what they are.
Very good point that being disabled is actually really expensive, and taking a look at the fact that health costs is all about the care costs as well. So now we're paying more and more contributions towards our care, and more people actually cannot afford their actual social care, and it's putting them below the poverty line as well. And as well as the S still like going away, like this expert showed us that we need equipment when we go away on trips, like hoists and other equipment, and non-disabled people do not have to pay for, and also hotel chains don't seem to want to cater for it.
Everyone's answers, obviously this is something that's filtering into every single area of life, and it all maybe stems from that lack of support at the top, like you're mentioning, Dan. So, you know, when we're talking about everything from healthcare to employment through to kind of, you know, social care, travel, housing, what do we maybe need to see change in advance so that these financial implications aren't just left to the disabled individual themselves, and so that people aren't put below the poverty line? I'd love to kind of get everyone's perspective on that.
Well, I'd say the biggest thing is inclusion, for one thing. Include the community and every decision that's made, whether it be a social decision or a financial decision. This affects our lives. Every decision made by something external impacts us. And there's an old saying that there is nothing about us without us. Now, another minute, that's never been true than ever. You can see it right across the board. You can see energy companies putting up prices, and then they're taking people away from support and stuff like that. You can see it with supermarkets that they're putting up food prices. You can see it everywhere. Prices are going up, but no one's saying to us, what can we do to help you within that spectrum? The be food, fuel, medication, or transport. Just to pick an example, you have city centres now, which are because obviously they want to make them green spaces and low traffic emission zones, which is good. But a lot of blue badge parking places are within town centres. So decisions are being made to cut things off without having conversations with us first. And of course that has an implication. If you can't drive to the city centre in your mobility car, you've got to park outside and use public transport, which is always getting an upgrade, but not getting an upgrade to make it accessible. And it's the same with healthcare. It's the same with everything. It's with food. It's right across the spectrum. Engagement with the community. Have these discussions with us. Let us have input. Let's have input on suggestions. Let's have input on just decisions making. That's where you start. That's where we get equality. That's where we get the ideas. That's where companies can realise that they can benefit, and organisations can benefit from our input and have fully inclusive practice across the board.
I think Dan's absolutely right, and starting at the top is so important. I think some of the challenges are that the focus is on individuals staying in positions of power as opposed to listening to people as individuals and strengthening their voice in order to improve their lifestyles and to empower them. The fact that as a Wheelchair Alliance, we're trying to get an all-party parliamentary group purely for wheelchairs, which we think is crucially important. But actually to try and get engagement from policymakers is really, really tough. And some of that voice, the people's voice, and the power of strengthening that voice is crucially important. If that's not listened to, we go down the very roads that you're talking about, Dan. And the challenges that we have around some of those improvements that we want to see in society is that nobody's capturing the accurate information. And if they do capture the accurate information, they're not analysing it and using it appropriately. So I think, empowering people and having a voice, getting accurate evidence to stimulate change, and actually trying to get the people who can make change happen listen at the top is some of the biggest challenges that we all face.
I just think, back up Dan and Karen really, it's just about involving disabled people in actual change instead of just having a tip box. I quite often see companies that think that they are doing the right thing, but they don't actually have anybody with any impairments in their workforce or in their government task force that can actually advise them on the actual effect of any changes that are being made. So I just think it's just about involving disabled people, and then we can always move forward really.
I think one of the interesting things there that you highlighted, Helen, is that there's not that kind of policymaker voice there. So for you, Karen, what would you maybe say to policymakers to encourage them to make that change, just off the back of your answer?
What would I say to them? I actually think that the evidence is there. They're just not either looking hard enough or they're not hearing it. Certainly, I think that organisations that we all belong to, if we collaborate to strengthen the voice, we can make policymakers change. I can give an example, and I apologise, although I don't really apologise, that I'm talking about wheelchairs a lot, sorry. However, the Wheelchair Alliance is getting quite noisy. We want to hear from all of you to strengthen your voice. We're getting noisy enough for NHS England to approach us, to ask us to help co-produce a quality framework for wheelchair provision. That's vitally important. If we're going to drive out policy, the postcode lottery around accessing equipment, the only way we can do that is by having some sort of a quality framework that is in place across the whole of the country. Loud voice, start making people sit up, and then start pushing for change. But we have to have the loud, inclusive voice, and the voice has to come from people with experience. So that's the crucial thing that makes policymakers sit up and instigate and implement change. I'm always the optimist. We will make things happen.
The idea of making noise, especially when it comes to changing policy, getting new things in place, because I feel like in this community everyone's always making noise and asking for it, and it's getting the right people to listen. So obviously we've kind of touched on the fact that we need this change, here's what we can do to make it happen, but the reality is that it's not happening straight away in a lot of situations. So until we see change, until we see new initiatives in place, maybe some strategies that people can put in place to maybe improve their own financial literacy and look out for themselves in a situation where not many other people are? I'd love to ask you, Dan, first of all.
The first thing I'd say is explore here. Literally walk around here. There's so many great stores with so much information on them. if people are looking for support or guidance when it comes to things like financial activities, stuff like that, the biggest tool, social media, Facebook. There's some fantastic groups on Facebook run by disabled people that just pass information across freely. It's incredible. Social media has become the hub for the community, I think, to share information, which is just absolutely fantastic. But with regards to policy, you are absolutely right about that. I think we will get there in the end, but we shouldn't have to be going looking ourselves for external financial support or any other support. But this should already be in place. This should be bedrocked in this is how the sixth biggest economy in the world. I mean, we had the UN report a couple of years ago, which absolutely took the government to task on treatment to save people, and they're coming back, I think, later this year to see how far we've progressed. And I'm sure we can all agree, not very well. So the government really needs to engage more with disabled people's organisations directly to listen to policy, because as you said, the reports are there. There's endless reports. Every day my inbox is filled with another cost of living report that's come out, another cost of living report that's come out. And as I was saying just now, it's got to the point where I feel guilty because I'm no longer shocked at what I'm reading, because things that gives me a hammer to push on again. So we have to politicians, the issue we have politicians in the government is that their life very much described. This is also the prime time, as the election is coming up, and as the disabled community in itself is growing, which is true thanks to the advent of long COVID and things like that. We now have the time, now is the prime time to be collectively asking the government, through any means necessary, local MPs, Action Network, letters, communities, whatever, to ask what they're going to do. How are you going to win our vote?
Whether there is those maybe personal things you can do to improve financial literacy for individuals until that happens.
But yet, I like what Dan was saying about how important there's 1 in 5 or 1 in 4 of us in the UK that is disabled, and that our pound and that our views do matter, that how much the purple pound is worth. But I learned how to be financial literate just by managing my own care budget, by managing my own access to work, budget, and that taught me how to negate the world. But I wouldn't have been able to do that without the support of a disabled person's organisation when I was younger. So somebody who I met up with, who had been there, done it, and I was able to give me the actual skill that I needed as a disabled person, to another disabled person, to be able to live a life of my choice. And I feel that is what is kind of missing these days, and not as many disabled persons organisations around the UK. At the moment we are sadly dwindling just because of lack of funding, and also lack of real opportunity from local authorities who don't really see the value that peer support has. So for example, where I am near Southampton, the actual council gave the direct payment contract away from a youth-led organisation to a charity because they wanted to move to a more phone-based support system. And I think that is sadly what we are encountering today. But going back to what Dan said, brilliant is challenge your MP, challenge your actual local councillors, challenge them. They actually they need our vote. There's 1 in 5 of us. They need our vote, and then at the end of the day, they'll have to win it come in 18 months time or whenever the general election is. So just bear that in mind. Just win. They have to win your vote, and there's no harm in reaching out to other people for support around how to be a bit more financially savvy in this more difficult world that we are living in. We've got local councils now that are now cutting back on care budgets, even to like provide you with meal prepping, things like that. And so it's up to us to actually fight back and to actually to make people win our votes.
I think what you're seeing there about kind of the literal buck falling to disabled people's organisations is so true. It seems to be they're the only ones offering that helping hand, and yet even their funding's being cut. And I know we wanted to kind of touch on today whether there was any maybe initiatives or anything like that to support people, but it might be that there's just a lack of those. So I'd love to hear from you all on, is there any initiatives, whether they are from kind of government, like Access to Work, or whether they're from disabled people's organisations, that people could maybe utilise, or is it a case of they're not there and we desperately need them? Michael, do you want to start?
So I'm going to start on a little bit of a negative. So this current government's local enterprise partnership was supposed to boost job prospects for all disabled people, and obviously it hadn't. But Access to Work, although it's not a direct financial empowerment, it does make funding available for employers to facilitate reasonable adjustments, and you can get support worker costs from it, although the waiting list is about as long as my arm, which is long. So and the actual battle to actually get it is quite hard, and I think that actually puts off quite a lot of disabled people, because we're actually bored of fighting, we're bored of having to have an argument or to have or to state our voice quite clearly about what we want. But there are some great funding grants programs out there. There's Kaleidoscope, there's the Cambridge Social Ventures, so there are some great social ventures out there that are available for funding.
So what's out there? Michael made some really interesting suggestions and points, and in particular about organisations predominantly that are, I assume, reliant on charitable giving, which is being squeezed at this moment in time. So that's a bit of a problem. But there are obviously charitable organisations that support people. I would make a plea to some of the public sector organisations that would support people with a disability to actually produce their literature and some of their ways into accessing some support in an understandable language. And I think I speak English, but boy oh boy, I have no idea what the notional personal budget is. It's jargon which puts people off, and eventually people will just switch off and find their own way. Having said that, there are some great things going on. We've been working collaboratively with Motability. We've got some really great grants going on around transport, around wheelchair provision, around actually funding some research that can hold the politicians and the policymakers to account. So there is some good stuff going on there. We just need to know where it is, and that in itself is a challenge.
Absolutely brilliant points, if I may say so, from both of you on that. Yes, I mean, a lot of organisations have had funding cut. I mean, ourselves at Disability Rights UK, we're a DPO group, disabled persons, and we're still pushing and pushing and pushing. We're one of the lucky ones now to secure funding and keep pushing the word out there, but there's so many groups we're seeing falling by the wayside. And this does come down to cuts, governmental cuts or local services cuts, but what we're seeing is that with one hand, like the new rules on the Access to Work scheme, the government give with one hand and they're taken away with the other. You had 290,000 people removed from the warm home discount scheme last year. So they're not balancing it out to make things any easier. So we promise you this, but this is got to go. So that's where it needs to stop. There needs to be proper funding. The government can always find money for projects when they need it. And that's true at the end of the day. They say they don't have any money. They do have money. They just choose where they spend it. They need to be spending it on a portion of the community that for so long has been misunderstood and has been misstereotyped. That's what they need to put it. They need to give us the tools to be our own support, but they have to stop cutting. They have to stop cutting at the weakest, because there's literally nothing else to cut. We're through the bottom of the barrel now, we're into the basement. They really have to have a reality check and just fund things to the max. But I also think changing the tack, your point about language is really important. Really important. We're seeing a lot of supposed groups who are there to support the disabled community not using the right language, not even using a simple thing like Easy Read. They're making a lot of mistakes. If there was proper engagement between those groups and DPL organisations, there'd be a lot more fluidity, things would be a lot more on an even keel, things wouldn't be so fractured. So there is still so much we have to do, but I believe that every single person here today can do it. Every single person in their own little way. No matter how small it is, everyone, if we all chip together on this and focus in the same direction, we will get there.
No, brilliant answers. And I feel like we could talk on this topic all day. There's so much to it. It affects every area of everyone's lives. But I'd love to open the floor up to questions now to finish off. So I think we have one at the front here to start with.
Thank you. My name's Philip Connolly. I've initiated something called the Disability Resilience Network. And one of the reasons I did that is because the charity sector is beset by one model. The idea that we only need is more research and the government will accept the argument. And I think what we need is a power analysis. We need to take power away from government and we need to empower local communities and individual disabled people to become a collective force. And there is power within the disabled sector. There is power within the numbers, there's power within the earning potential, there's power within the Purple Pound. Disabled people need a storyline about how they feature on the demand side of the economy and not just the supply side of the economy. We need a storyline on disabled people as creators of new markets, as inventors of new products, as people who run and own and start businesses. And we need to start taking that wealth away from government, in a sense, and using it to the benefit of disabled people. We need to start even creating money. Citizen welfare bonds, purple pounds. We need in effect to create our own currency too. We need a much more green ethos about how we respond. And a lot of the thinking's been done in the environmental movement, but the disability movement's decades behind. It's got to change. I'd like to ask all the panel what their power analysis is. How are they going to take power away from government?
Well, I think a prime way to take power away from government would be to actually see someone from government here today. Has anyone actually seen anyone of any political party walking around today? Put your hand up if you have. Yeah, exactly. There we go. Politicians have to come out of the shadows. They need to come out of the shadows and come to places like this. We can say exactly what you've said directly to them. The disability minister, even the shadow disability minister, should be here today. This is a national event. This is a prime event in our calendar every year. The disabled community, I say this all the time, is wonderfully, beautifully, richly diverse. And I'm so proud to be a part of it, and I love it utterly. It's just everywhere. But the government doesn't see it like that because they're still stuck with the stereotypes. And like I said, I keep going on about stereotypes, but once you smash these stereotypes, once the government starts to understand the social model of disability, then, possibly then, we could see that empowerment come to us. But unfortunately, we've still got this brick wall between us and them, and we can keep having these conversations every time, year after year. But until they actually get their head around what the issues are, like I said, until they turn up at places like this and make themselves freely available. They're supposed to represent us at the end of the day. The disability minister is supposed to represent us, so they should be here taking questions. Not deflecting questions on question time and stuff like that. That's where I think the answer lies.
I think there's a real disconnect between SailPeople and all the political parties at the moment, and there's nobody really that is doing that much or appear to want to do that much or SailPeople. I think it's up to the different people as a movement to actually make MD, to make cancers come out of the shadows so we can channel them.
Do we have any other questions?
I'm a parent to two children, and they're both on the autism spectrum. Up until my children having a disability, I didn't actually know how discriminated against disabled people are. What I find shocking is how dismissed. The minute you have a label on you, it's like you're not good for anything, and I'm fighting these discriminatory labels on my children because the labels are there to support them. Also, what I find shocking is the amount of money that is exchanged in the name of disabled people. I think that disabled people need to just take control. You know where the money should go. I find it shocking that the people in charge of giving support to my children do not understand their disability. And I would prefer, I'm neurotypical, I would prefer someone who is neurodiverse or on the spectrum or with that disability to work with my children because they understand them better than anyone in the neurotypical society. So I absolutely support you guys as a parent in doing things for yourself and taking control of that money. And I'm really happy to be here today and to see the empowerment of disabled people. And I'm sorry that I've been so ignorant my whole life that I didn't see it. And I get emotional. I'm sorry that I've had to see this from a parent perspective.
You should ever apologise. I think the important thing about everything that people are saying here is about learning and then learning and carrying on to make a difference. So never apologise, and I think your points are very well made. To make a difference, we have to speak loudly and we have to join together to make that difference heard and the impact made. I hear what you're saying about taking control as a disability society, as a society with a high number of people with different disabilities. That's a long-term approach, and that needs a lot of planning, and there's a lot of different groups. So actually to try and bring those together, to actually have a crescendo of power and to influence change is going to take quite a lot of doing. This is where that change happens, and your point that we don't have any ministers here is very well made. You try and talk to a minister. I have tried numerous times, and all I get is emails straight to their undersecretaries or their assistants, and so on and so forth. Now, if that's happening to me from a very small organisation, you think how many other groups exactly the same is happening to. And I think maybe that is the message that should go to ministers. You're just not listening.
Absolutely brilliant, and there is no way you should reproach yourself at at all. This is not down to you. This is down to a lack of inclusion. Changing subject a bit, but this is a lack of inclusion across all the mediums of media that we have, which has influenced this. This is stereotypes that have influenced this. I mean, you have major media corporations either saying that we're all fantastic Paralympians or we're all charity cases, and there doesn't seem to be anything in between. I was in your situation before my daughter was born and before I was diagnosed autistic. It was exactly the same thing, so you should not reproach us. You're obviously a fantastic, passionate parent, and I'd love to speak to you more afterwards. I really would. But it's not your fault. It's society's situation where we're not approached, we're not discussed. Everyone talks for us. Health authorities are not employing the people that should be in that situation to work with us. The point in case was my daughter's autism diagnosis was first put through local services by someone who wasn't autistic. In the end, we got him struck off because he was so appalling to my daughter. We had to pay, I think, the best part of £4,000 on a credit card to go private, but then that was run by autistic people. And when my daughter got her diagnosis, instead of it being all dour and negative, the first thing they said was, "Great news, Emily, great news. You're in the club. You're in the PDA Autistic Club." And it just meant so much to her because it gave her empowerment. And empowerment is where it's at. So, yeah, I'll say again, you should not feel bad. Please don't feel bad. This is not your fault. This is greater society at fault here. And it's making you feel that way, and it shouldn't make you feel that way at all. It really shouldn't.
First of all, it's back up what Dan and Karen said. They never apologise. Most times it is all about rage, how the media portrays their people. And how society has been trained to think of self people by putting labels on the back. For example, the actual blue badge, if you look at the actual blue badge, it's a wheelchair symbol, and most people that actually use the blue badge aren't actually wheelchair users. So therefore, society implies that everybody with a blue badge is a wheelchair user. So don't ever feel bad. Labels are always put on people, and that's unfortunately the society we live in. But together we should be able to look at changing it and look at seeing the positives of all impairments, all disability, rather than just focusing on the negative and the charity model, and that we all need to be saved and pitied and labelled and put stuff on the box and be put away and then we just put into some little corner somewhere. I think it's about embracing it, and yeah, I hope in the future with support from all of us, you and your family can do that.
Say that you aren't on your own. There's so many thousands of other families newly to this like you are, and they're on social media. I'll talk to you after, is that okay, about everything like that, but please don't feel alone. Just search for them and they're there. They're really there, and they'll understand, and they'll get it, and they'll support you in your local network, okay?
Just to echo that, I think for kind of everyone here and for yourself, this is a space where I think it's important to emphasise that your voice is heard, and this is where the change starts, definitely. So, yeah, another question.
Hi, thank you. Just to say, I'm a mum of an autistic teenager, and I'll talk to you afterwards as well. I just wanted to say thank you. Professionally, I work for a local authority as a commissioner, so I wanted to say, like, I'm here listening. Obviously, not everyone is, but that clearly needs to change, and we need to get more people who have some, power in the situation to be listening and hear the voices. locally where I work, obviously we're trying to change and make ways differently through working with different groups, and we kind of fund some, particularly I work in learning disabilities, but some groups to kind of work with people to give them the voice to then help us how we make decisions. But I just wondered whether there was, thinking of the financial sort of aspects, anything that we could do differently. Generally, I heard what you're saying in terms of maybe funding local organisations to then support people. Is it about looking at personal budgets differently? I don't know if there's anything else that, if you had a magic wand, that you would do differently. That's in the context of, we're having to make difficult decisions because we've got less money coming in, and obviously listening to people is the key to that. But
Absolutely, I hear about finance and personal budgets. It doesn't help that everything's been squeezed at the minute to the last drop, and also about supporting those families, disabled people and carers around probably your local authority. But one thing I'm finding at the minute, it's probably a bit off tack, but with the cost of living crisis, is that people are not really wanting to talk, and not really wanting to put their head above the parapet and explaining their family situation. This is the same. We're worried about grief now. Things were suddenly being taken away from him. The more he named and blamed local organisations, the more things were being, services were taken away from his family member. And that's a very worrying trend that we're in now. But I say, in order to reach families, if they're not going to come to you, the tact is, I know I keep banging on about social media, but it is a great tool. It is a fantastic tool. There's always someone local, there's always community groups, there's always, there's just groups where disabled people go, and especially at this time they'll be using things like, if you've got a local warm bank in your area, for instance, go to things like your local warm bank, your local community centre. I mean, I know it means a lot of work on your behalf, and I don't want to tell you to start going out frog matching around your local area there, but that's the sort of thing, it's knowing these particular areas that have sprung up of support networks, just to go in and just have a look around and just gently introduce yourself to people. But you're right, budgets are being squeezed so hard at the minute, but like I said before, there is money. There is always money when they want to spend it, and we need to keep reminding them of that.
It's great to have a commissioner here, and I think I'd like to thank you for being here, and anybody who works in the public or social sectors. If they come here and listen to people, it actually enables them to hear and then to make change. We actually have a commissioner on our board, a volunteer, because she wants to make a difference, and by doing that she is hearing the user voice. So I think that's vitally important. I would ask commissioners, picking up your point down about there's always money, to think about longer term budgets rather than annual budgets, which really cramp NHS and social care provision because they're constantly battling. Think about the 3 to 5 year plan, which actually you give to private sector, but you don't give to your NHS providers. So you don't enable them to be fleet of foot, to invest, to save, and by saving, it gives them more money to invest into supporting people with the equipment that they need to live an independent and inclusive life. So I think longer term vision is crucially important, but thanks for standing up and being candid.
So first of all, thank you very much for coming. It's very rare to be a commissioner out and about, so there we go. So I think I'm going to focus purely on health, social care and personal budgets. So for me, it's about peer support, about disabled people supporting other disabled people, but the actual organisations that have disabled people get paid for it, so it's a proper representative job. After that, for 15 years, I've supported about 2,000, I think, disabled people to like, make choices. Some of them might not be my choices, but it's the actual person that you're supporting to make choices. Also, it's all about engaging with the adult social care teams. So it's about so we all know that my money is really, really, really tight. Okay, let's not be about the bush. I mean, talk about that all day. But also, people can make good choices from the money that they do have. And sometimes it's about somebody else who is whatever impairment they have. It's about them learning from it, and also the actual social workers learning from us as well. So, for example, I ran a support planning pilot project that worked with both the social services and the end user, and to try and make the disabled person more interested in their support plan, to actually have this money and to go and negotiate with services, with PAs, with everything to say, right, and then that leads to a lot more empowerment of the disabled person. I could talk for ages about this, but I won't. But it's about empowering the disabled person to make their own decisions, but also giving money in advance to actually disabled persons' organisations. So peer support is really important, as well as using the social media. Thank you.
I think we probably have time for 2 more quick questions, so we'll go this side first.
Hello, my name's Paul. I'm a full-time carer, I've been for many years. My question is, not only governments, but local authorities. Because why is it, up and down the country, whenever you raise an issue, you then become the object of blame with many councils and local authorities? Take an incident like recently that happened to me. And how do you get councils to respect the Care Act when they clearly either don't understand it, are not trained in it, or just have simply no disregard for it? And the government, well, I think everyone said what they said in the government. So, yeah.
Good question, thanks Paul. Because we are seeing a rise at the minute, unfortunately, of institutions rearing their head again. And they are not cost effective, and they're horrible. They're really horrible things, places to put people into, really are. There needs to be more community-based places for disabled people in the community, more accessible housing built, certainly more community-based people where everyone can mix. And the problem with local authorities is that they really, really don't understand. I mean, I can understand they're under financial pressure, but that doesn't excuse attitude. Doesn't excuse attitude at all. But we have to look at the inner machinations in the workings of local council. My wife ran independently as a local councillor a few years ago. And unfortunately, the local council machine went into overdrive to literally destroy her influence as a local councillor. So unfortunately, a lot of local councils aren't what I'd call humanely workable institutions. We need to have better representation, and fair, we need to have more political parties out there instead of just the 2 main choices squabbling over it every now and again. But government also has to, like I said, find that money to find local councils. I mean, so many local councils on the verge of going bankrupt at the minute, and yet money's being spent elsewhere across the country on projects that you look at and you think, well, okay, I don't know who dreamt that one up, I don't know what they were smoking when they actually put that one together, if we see what I mean. But there is money, and money needs to be diverted to local councils to literally take care of people, because people need to be taken. We're living longer. Long COVID is increasing the amount of disabled people. More disabled children are being born. do you know what I mean? The Care Act is essentially the Care Act. And that's what it is, you know, the 4 letters, care. It's a wonderful word. It's not a bad thing. Care is never a bad thing. We all, at some point in our lives, will be disabled, whether it be permanent or temporary. At some point in our lives, we will always be a carer at some point. This includes local government people and government people. They need to understand that. And once they understand that, then they'll find their empathy, then they'll find their sympathy, and then they can start battling for this finance.
Really interesting question about how you involve local authorities, Paul. And I do wonder whether Health Watch, which is meant to be local, is completely wrongly titled. I mean, it's not about Health Watch, it's about Wellbeing Watch, and actually that would be way more inclusive of the local councillors, the local community. And I think maybe we should challenge. Oh, it's words again. Sorry. It's words. Let's use let's call it what it is, as opposed to segment it into its health or its social care or its education or its access to work. Actually, the whole thing needs to be glued together in order to make the difference.
I think that's all we have time for at the moment. I know a lot of other people have questions, so maybe once we're kind of moved out of the way, if any of the panellists are able to stick around and answer those, I'm sure that if they have the time, they will. But I want to thank all of the panellists for coming today and being involved. And thank you everyone for coming out in the questions. As I say, I'm sure if anyone has time to stick around and answer them, they will do. So thank you very much.